Happening today, the World Health Organization will announce whether it'll end its COVID-19 emergency status, which was put in effect 3 years ago today. So now we want to take a look at how we got here. In January 2020, the WHO announced the outbreak in Wuhan, China. 10 days later, the CDC reported the first case of COVID-19 in the U.S. Later that month, the WHO declared the outbreak a public health emergency. In February, the CDC reported the first COVID-19 death in our country. Then in March, the pandemic was declared and states shut down. The next month, the Trump administration launched Operation Warp Speed to produce a vaccine. Later that year, after being developed, a New York nurse was the first American outside clinical trials to get the COVID-19 vaccine. In March 2021, Texas Governor Greg Abbott lifted the mask mandate and opened the state. We fast forward now to December, where we saw the first case of the Omicron variant in the U.S. In January 2022, the U.S. reported nearly 1 million new COVID infections, the highest daily total. In May, the number of deaths in our country reached 1 million. After a series of trials in December, the FDA authorized vaccines for children down to 6 months of age. The latest for the Coastal Bend, the city-county health district's numbers from Friday show 264 new cases. Now, since the start of the pandemic, over 120,000 cases and close to 1,600 deaths. Sunrise reporter Cordero McMurray is live on Shoreline Drive. You spoke to local health leaders and people here in the Coastal Bend. How are they reacting to the upcoming announcement?
Sierra, when I spoke with the health authority for San Patricio County, Dr. James Mobley, he says if the World Health Organization says that the emergency status is over, things such as the free COVID testing, free shots, and special provisions for Medicare and Medicaid would go away.
Either the states will have to pick them up or people will have to pick up more of the costs of these things.
Mobley says the decision is all about funding. He says he's received extra staff at the San Patricio Health Department because of the COVID emergency status. But if that goes away,
I've got to figure out, can I keep them on because they're doing a great job, or are we going to have to cut back?
According to the CDC, just over 1.1 million people have died from COVID in the U.S. alone.
We still have a lot of people that are getting sick and continue to get sick. Then we have people that do not want to get the vaccination because they think that they're going to be injected with something.
Ramiro Reese and Ezra Acevedo say they're concerned that ending emergency status now could be too soon.
Started out in 2019. It was a big thing, very serious. A lot of lost lives, a lot of loved ones were gone. So it's definitely something to take seriously.
And Dr. Mobley says we'll need to pay attention to what happens next.
So what provisions are we going to keep in place, emergency or not, especially to push those immunizations out to the countries that still have very low rates of immunization?
Another thing, if the emergency status ends, the increase in SNAP benefits that we saw rise during that time, that also could come to an end. Reporting live in Corpus Christi, I'm Cordero McMurray. Chris, 6 Sunrise. Back to you guys.